Hello, I'm Michał. I'm a veterinarian, and today I would like to tell you about the problem of ovarian acyclicity. Of course, there is a lot to say about ovarian acyclicity, but I would like to focus more on a practical approach, meaning what interests us in a herd, when it occurs, what to pay attention to, and how to treat it in the field. Ovarian acyclicity can be divided into ovarian inactivity, ovarian cysts, and the occurrence of persistent corpora lutea. I will tell you a few words about each of these cases. Let's start with ovarian inactivity. What is ovarian inactivity? As the name suggests, inactivity means there is no function. The ovary is not performing its function, or the structures on the ovary are not performing the function they should. This means that most commonly there is a lack of follicles, or if these follicles are present, they are very small, up to 9 mm based on my observations, and of course there are no corpora lutea on the ovary. This is our criterion for diagnosing ovarian inactivity, when we do not see any corpora lutea on the ovary during the cycle. Why does ovarian inactivity occur? There are several reasons. The main cause of ovarian inactivity is a lack of energy. Therefore, if ovarian inactivity occurs in the herd, we must place great emphasis on nutrition. And not just the nutrition during lactation, but also the nutrition during the dry period. Let's say a few words about that. When it comes to nutrition in the dry period, it is usually divided into two parts. The second part, which is the 3 weeks before calving, is crucial. And we must pay very close attention to what this nutrition looks like, what the energy supply is, and the status of micro and macro elements. The best way to see if there are any nutritional errors occurring during the dry period is to test for subclinical ketosis. That is, we test the blood of all cows that have calved over a certain period of time for ketone body levels. We test this between the 5th and 7th day and calculate the average. If it turns out that the cows have a problem with subclinical ketosis, we must adjust the nutritional ration. The second most common cause of ovarian inactivity is, however, a lack of micro and macro elements. We need to focus on various micro elements, but the key ones are copper, iodine, zinc, phosphorus, selenium, and vitamins A, D3, E, which are fat-soluble vitamins. We must have this secured. And what happens when there is not enough of these vitamins? Ovarian inactivity often occurs, and it is frequently the type of ovarian inactivity that appears on day 60, 70, or 80 after calving, and not right at the beginning. Of course, ovarian inactivity can be a complication after many diseases. It can be a complication after ketosis, it can be a complication after postpartum hypercalcemia, milk fever, or it can be a complication after difficult calving. In those animals, we observe that ovarian inactivity occurs more frequently. How do we treat ovarian inactivity? It depends on the cause of its occurrence. The first thing we must pay attention to is correcting the nutritional ration regarding both energy and micro and macro elements. What can we do to help the cow quickly? Here, time plays a key role. Once we supplement what the cow is missing, the oocyte needs time to develop. We know that an oocyte takes about 70 days to form on average, so it's not the case that after treating ovarian inactivity, cows become pregnant very quickly. What can we do? Treatment is most often very varied, and depending on the herd, we can treat hormonally. We have several hormones at our disposal, which we administer depending on the hormone regimen. In the case of ovarian inactivity, it is often common to administer hormones at higher concentrations or in higher quantities than usual. They are often combined in the therapy. These are also often cyclic therapies, meaning, for example, we administer hormones for 5 or 7 days, every day at the same time, in order to stimulate the brain to secrete hormones and to restore hormonal balance so that the ovaries start working. If we know that the problem is also a mineral and vitamin deficiency, it is always worth supplementing vitamins by injection, or via boluses, or both. Remember that ovarian inactivity is a really big problem, and if it occurs in the herd, you must always be in contact with a nutritionist. Here, the cooperation between the breeder, the veterinarian, and the nutritionist is crucial. The next type of acyclicity is ovarian cysts. What are these cysts? A cyst is a formation on the ovary after the 40th day postpartum that exceeds 25 millimeters. When it comes to cysts, we must focus on their classification. Scientific classification consists of 3 parts. We have follicular cysts, where the wall does not exceed 3 millimeters. We have transitional cysts, when a follicular cyst turns into a luteal cyst. The third type, a luteal cyst, is a cyst where the wall exceeds 3 millimeters and is active to hormones. In clinical practice, the most important thing is to distinguish whether it is a follicular cyst or a luteal cyst. Transitional cysts have no clinical significance here. When it comes to cysts, the biggest problem is, unfortunately, follicular cysts, because their treatment is the most difficult. Luteal cysts, because the wall consists of luteal tissue, are usually sensitive to the hormone prostaglandin and are easier to treat. Let's focus on the causes of cysts. There are 2 main causes of cysts. The first is a lack of energy, and the second is the presence of mycotoxins in the feed. And now, as we discussed for ovarian inactivity, regarding the lack of energy, great emphasis must be placed on nutrition. Nutrition in the dry period and at the start of lactation. And when it comes to mycotoxins, a very important element is testing for these mycotoxins. How do we test for mycotoxins? You can, of course, test each of the TMR products, but the simplest way is to test the TMR. We take a handful of TMR from 10 to 20 places in the barn, put it in a container, and send it to a laboratory. The result will allow us to see what we are dealing with, what high levels of mycotoxins we have a problem with, and to choose the right preparation for the given herd to deal with these mycotoxins. When it comes to follicular cysts, the problem is much more complicated because they are often very hormonally active, meaning the cow shows estrus symptoms and excitement for a longer period of time. She is restless. Mucus often occurs, she jumps on other cows, so she behaves as if she is in heat. But it lasts for a week, 2, or sometimes even longer. Sometimes it happens with follicular cysts that the cow shows heat for only 2 or 3 days, then it is quiet, and then it happens again. Therefore, if we have such a report from a breeder, a light bulb must go off immediately that we might have problems with cysts. Regarding treatment, we usually have hormonal treatment, and this is also in larger doses of hormones. Treatment can be associated with acting directly on the ovary itself and acting on the hypothalamus, and thereby indirectly acting on the ovary. In my practice, I usually begin with injectable hormonal therapy. If this doesn't work, I apply vaginal therapy, also hormonal. If that doesn't have an effect, I usually puncture the cyst. Remember, when it comes to puncturing a cyst, we must be very careful not to damage the ovary structure. It is best to do this under ultrasound control, and there are a few things worth noting. First of all, cleanliness. Let's remember to do this in a clean way, so the injection site must be washed, it must be disinfected, and we must also have relatively clean hands. If we are already rupturing the cyst, it is good if the fluid inside the cyst does not get into the body cavity. Therefore, we either puncture through the body wall, through muscles, through skin and muscle, using a long needle, or we puncture it by inserting a hand into the vagina, but then we must have a tube that will drain this fluid to the outside, because we do not want this fluid with hormones to get into the cow's body and continue to act. I will also tell you from my experience that sometimes it happens that we have a cyst on one ovary, let's say the left ovary, and the right ovary is completely active. We have clear corpora lutea, a corpus luteum with Doppler flow. We have follicles of different sizes. In that case, I try not to worry about that cyst and synchronize the cow from the right ovary, that is, induce ovulation on the right ovary. And I tell you honestly, this often works. Can supplementary treatment be used? Of course, if we know the cause, if it is a lack of energy, then we can, for example, supplement that energy during hormonal treatment with a rumen bolus. Remember that cysts should not occur in more than 5% of animals in the herd. If they occur in more animals, then you need to correct the ration quickly. First of all, talk to the nutritionist, the breeder, and correct the nutritional ration, or introduce a preparation that will protect our cows against mycotoxins. Finally, I left a problem which, in my work, is not a problem at all. But it is ovarian acyclicity. It is the persistent corpus luteum. Why is it not a problem for me? Because in my work I use hormonal programs in basically every farm. And with hormonal programs, the corpus luteum is broken down at some stage. So it is not a problem. In which herds is it a problem? Where hormonal programs are not used, and it happens that the corpus luteum is simply persistent, meaning it should have been destroyed by the influence of prostaglandin secreted in the uterus on the 17th or 18th day of the cycle. But it is not, and it persisted. So there is no cycle, because there is no drop in progesterone, so the dominant follicle cannot grow, and there is no ovulation, and there are no symptoms. Therefore, often if we have such herds where we come only, let's say rarely and only on call, when there is no regularity in breeding, then such corpora lutea do occur. But in the case where we use hormonal programs, such corpora do not have a reason to exist. Remember that ovarian acyclicity is a mega-complex problem. It can be linked to metabolic diseases, linked to udder diseases, linked to hoof diseases, or linked to birth problems. Retained placenta, milk fever, trauma during parturition. All of this has an influence. Therefore, there is no silver bullet for how to prevent acyclicity. But remember one thing. We must pay attention to how cows are kept, how cows are fed, and what happens on their ovaries and in the uterus after birth. To sum up, ovarian acyclicity is one of the main problems we deal with every day while working on reproduction in dairy cow herds. Of course, it is a solvable problem. You just have to be a bit like Sherlock Holmes, just in the barn.